Hi, yes, hello everybody, and welcome to our rearranged episode 2 of the Vegan Party Conference live streams. It's a little series been running. This one was due to have run a couple of weeks ago. Unfortunately, I was waylaid and unable to attend due to unavoidable circumstances. But here we are on August 29th, live at 6 p.m. And I'm very happy to say that we've got two guests today. Shireen Kassam will be joining us shortly. And then we also have James O'Toole, who is going to join us from the Plant-Based Treaty. Unfortunately, Anita Krajnc was unavailable to join us today, which we'll try and see if we can get Anita on for a future one. The Vegan Party Conference takes place at the Kensington Town Halls in September, the 28th and 29th. And it is very much a conference for anybody involved in animal rights, veganism, plant-based shifts, foods, plant-based food systems. So if you're vegan, if you're an activist, if you're indeed not yet vegan, but sort of plant-based curious or interested in aspects like food justice, environment issues, wildlife, healthy living, and animal welfare, then most certainly this is a really interesting conference for you, because we're gathering, in many respects, the core of the Vegan Animal Rights UK activism groups and grassroots. So it's quite a unique mix in that respect, that we've got most of the major campaign groups on board, so they'll all be represented at the conference, and also quite a few grassroots activists. So the conference is made up with a series of panels. We've talked about a couple of those panels this evening. And then there's also some really good workshops. There's around about 15 panels and 25 workshops, something like that. And then a presentation, a celebration stage where we've got a number of birthdays happening. Viva at 30 years old this year, Vegan Cyclists at 80, Animal Justice Project at 10, Vegan Runners UK at 20, and Veganuary also 10 years old. We will indeed be having Matthew and Jane from Veganuary a little fireside chat at the Vegan Party Conference. So Vegan Party Conference is open to everybody, very welcome to attend. It's easy to get to. It's in London. It's happening in about a month's time, September the 28th, 29th. Tickets pretty cheap. They're not expensive. You can come in for a day at £10, or you can come in for the weekend at £18. And if you're part of a campaign group at the moment, keep an eye out for those 20% discount codes, because they're on offer for the campaigns and supporters. So that's it in a nutshell. We've got, as I said, kind of core vegan community. There's some really, really interesting people, over 100 speakers at the moment, and all sorts of great sessions. So last time we had our live stream, that was a kind of back of July. It seems like another lifetime almost. So much has happened since then. We had Anita Krajnc from Animal Think Tank, and Tom Harris from Shack Justice Project, very much looking at animal rights, animal liberation, and roadmap to animal liberation. This evening, and you can watch that, by the way, you can go to the website VegfestUK, and you can get the live streams. There's a live stream tab there on the menu for the Vegan Party Conference. So you can see that tonight, though. What we're looking at is very much a plant-based aspect of the conference. So the conference is open really for veganism, animal rights, and shifts to plant-based food systems. And our guests tonight are from the Plant-Based Treaty and from the Plant-Based Health Professionals. So first of all, we have Shireen Kassam from the Plant-Based Health Professionals. Just say hello, Shireen.
Hi, Tim. Hi, everyone.
Hi, Shireen. And then also we have James O'Toole from the Plant-Based Treaty, just joining us this evening. Thank you, James, for joining us.
Hi, Tim. Hi, Shireen. Hi, everyone.
Hi. So, James, you just joined us from Plant-Based Treaty. You're standing in for Anita, which is great. Thank you so much for doing that at short notice. Just give us quickly a brief overview of what Plant-Based Treaty is.
Yeah, well, so Plant-Based Treaty, we started 3 years ago, just before COP26. And we're the plant-based treaty is designed to put bottom-up pressure to promote a shift towards a plant-based food system that will enable us to live within our planetary boundaries. And our vision is a global plant-based treaty attached to the UN framework on climate change to enable a plant-based food system. And then we have a secondary goal for cities and institutions to implement best practices in plant-based food policies and rewilding.
And am I not right in saying that this weekend is the plant-based treaty's 3rd birthday?
It is, yeah. We launched just prior to COP26, and then we had like a soft launch on September 1st, I think, or maybe August 30th, but yeah, just up to 3 years ago.
Brilliant. Well, plant-based treaty has been a big part of my own life. I must say, since come across it 3 years ago, I've been consistently inspired and following closely. And plant-based treaty has been a big part of our shows over the last 3 years too. Always had sort of representatives, panels and discussions and such like. And will be a big part of our Vegan Party conference indeed. Shireen, plant-based health professionals popped up 7 years ago now, is it? 2017?
2018. We haven't marked any birthdays yet, but maybe we need to start trying.
So I remember actually the first time I heard was at one of our VegFest London. You came up with family just after the show and you said, "Oh, Tim, that was great. I really enjoyed it. But if you want any hand doing the health talks, we can do your whole schedule and probably do a better job than what you're doing." Which I thought, yeah, that's probably true. And it did. You've done whole schedules ever since, haven't you?
Yeah, thank you. So 2017 VegFest was when I first did my talk at VegFest and met like-minded health professionals there at the event, and that started off kind of cooking up the plans for plant-based health professionals, which formally launched in 2018. And we're a healthcare professional-led organisation that focuses on education and advocacy around healthy plant-based diets and lifestyle medicine to improve individual and planetary health. And we're very aligned actually with the mission and aims of the plant-based treaty. We want to see a rapid transition away from animal agriculture and normalising plant-based meals in every setting. And as healthcare professionals, we feel we have a valuable role to play in the vegan movement, because without bringing healthcare professionals on board with this message, I think it's going to be harder to realise the vegan world we all want to see.
Very much so. And how many, what sort of numbers have you grown to now?
In terms of our membership, we're around 1,000 members, of which around 2/3 are healthcare professionals and 1/3 general public. Our membership program is open to everybody. You don't have to be a healthcare professional. Anyone who wants to support our work and get involved, because diet change is something that we can all get involved in and support our families and communities to shift away from eating animals, essentially.
And would I be right in saying that, during the last 5 years, really, when a lot of things have gone quite quiet, but quietly, there's been quite big leaps forward in the healthcare acceptance and understanding of plant-based diets and the role they play. There's been a lot of research come out, hasn't there? And I think that's one of the key roles plant-based health professionals plays is being abreast of the research and being able to disseminate that information quite quickly. Tell us more a bit about the advancements you think that have gone on in healthcare.
Yeah, I think you're absolutely right, Tim. I mean, the science is pretty solid, and we're quite lucky that actually the evidence supports plant-based diets for promoting optimal health and well-being, and is best for us as individuals and best for us in terms of environmental health. And as you say, healthcare professionals are increasingly recognising this, but then they don't necessarily have the tools and skill sets to put this into action. And I think this is where we've been ahead of the game, where we're able to provide that education within healthcare settings that up until now has been lacking. And as my sister Layla would say, we're playing the inside game. We want to change curriculum, education within the areas where we have influence, which for us is in every setting in healthcare. And, with the NHS having over 1 million staff, treating hundreds and thousands of patients every year, I think, there's a really great opportunity to influence, certainly food in healthcare. It's really hard, I find, to talk about veganism. It's not received well, and it's not necessarily appropriate to talk to our patients in the healthcare setting, given that this is a justice movement. But it is really relevant for us to talk about diet change that's appropriate for them as individuals, for our staff, our patients, and also for environmental health, for the climate and biodiversity. And I think, that's where we're able to influence, and climate active groups have really come on board with this message, having spent, the first part of their existence only talking about fossil fuels. It's now commonplace within the sort of climate active movements within healthcare to be talking about diet change. And James is well aware of this, actually, because our leading sort of climate and health organisation called the UK Health Alliance on Climate Change, which I'm part of various working groups, has probably about a year ago actually signed the plant-based treaty, which is incredible for us. And just ahead of the launch, but on October 16th, the UK Health Alliance on Climate Change is launching their food policy briefing, and I think we'll all be very happy with it. We've been part of the working group, and James, it says in the document that healthcare organisations should sign the plant-based treaty, giving a little description of the plant-based treaty. So it's just actions like this that can, bring plant-based diets and their benefits into the forefront to that sort of high-level healthcare structure, which hopefully will feed down to the sort of, everyday doctor, nurse, allied health professional working within healthcare. Is Tim frozen, James? Or are we frozen? Oh, James, we've lost our host, James. We may as well just carry on then.
Host, yeah.
Yeah, well, we're still in the show. So, but yes,
here,
I think that's going to. Yeah, I think I'll email you afterwards and update you and share ahead of the launch around the UK Health
definitely.
Alliance.
Thanks. And yeah, you're so right. Like, I mean, the reason why the plant-based treaty launched really was out of frustration that all the focus is on fossil fuels. And so we wanted to make plant-based part of the conversation, as did you. And so I think we share that vision, and it was fantastic last year. We joined you at the VegMed conference. That was fantastic. We had lots of amazing conversations with doctors who are really happy to try and we had that plant-based starter kit, and they were happy to take that and have those conversations with clients, like you say, so with patients when appropriate.
Yeah, no, I agree. And I think there's many opportunities to have those conversations within healthcare because, food is served every day in all healthcare settings, and talking about normalizing the plant-based meal seems to be an area that we can focus on. And we've very much been working with Greener by Default to try and bring some of their best practice that you're clearly well aware of from New York City and Vancouver and probably other institutions that I'm not aware of as yet, but bring that good practice to the UK. So there's already work going on in the background that I think will sort of help both our organisational goals and missions.
Yeah, definitely. There's lots of great work going on all around the world in cities, and I'm sure in hospital settings and healthcare as well. So it's we're definitely moving in the right direction, but so much to do. Well, whilst we're waiting for Tim hopefully to rejoin, maybe I'll just give the audience a little overview of the plant-based treaty program. So I mentioned what our mission was, and we have 5 programs to try and help with that. The first is collecting endorsements. So when we launched, the focus was very much on collecting endorsements And so far, we've got over 150,000 individuals, thousands of politicians and businesses, and 30 cities around the world who have endorsed plant-based treaty. The second program is our city program. So when we launched, the goal was just to get endorsements, but we found that a couple of cities had just signed the plant-based treaty, but hadn't actually really implemented any policy or plant-based initiatives. And obviously that it's great that they signed the treaty, but we really want to see change. So now we work really closely with cities prior to endorsement, during endorsement process, and after endorsement to see what's going to be a good fit for them. Obviously, it's a worldwide treaty, and different cities have different kind of criteria and different areas where they can implement policy. So we work with different cities to see what's going to be a good fit for them. New York is probably the best example of that. They have a plant-based mayor, and they've been able to implement a whole host of plant-based policy, including in the healthcare front. They have in their 11 public hospitals, they have plant-based by default when you go to the hospital, and there's been a 60% uptake in that, which has led to, I think it's led to a 59 cents cost saving as well per meal, which is fantastic. And they also have they trained 200,000 healthcare professionals in lifestyle medicine. So diet change and the benefits of a shift to plant-based diet is talked about to patients when they go and see the doctor. So that's fantastic. The third program is menu change, not climate change, where we work with universities, other institutions, child education, senior homes, to see what plant-based measures they can implement. It could be carbon labeling, it could be plant-based by default, it could be even highlighting plant-based menus, plant-based items on the menu, or like trying to ensuring they offer plant-based milks, that kind of thing. The fourth is global climate talks. Fourth program, I mentioned that when we launched at COP26. We've attended every COP and Bonn climate conference since then. Last year, we launched our first report, Safe and Just, at COP28. So trying to influence policy and taking part in side events at these global climate talks. And the fifth program is training capacity building. We're ever expanding. So we're trying to train and recruit people to bring the plant-based treaty to their communities. So there are 5 programs. If people want to get involved, we do have welcome calls every Friday, and you can register for those on the website, plantbasedtreaty.org.
Great, that's super interesting. You've got so many programs, and it's amazing to see how it's grown. Have you got any sort of heads up on what's happening kind of in London? Because I'm always interested to see Sadiq Khan.
I know, Shireen, you recently launched, was it the a letter? Was that with like to try and get the hospitals to implement plant-based options?
Well, yeah. So, can you hear me okay, James? Because I think there's probably a lag. Oh, can you hear me, James? Oh no, I think is your connection going now as well, James?
Oh dear. Could you hear me before?
I could hear you. Yeah, you can hear me now?
Yeah, I can hear you good, yeah.
Okay, perfect. Yes. So one of our campaigns is called Plants First Healthcare, which, as the name suggests, is around more normalising plant-based meals within all healthcare settings, not necessarily just hospitals. You know, we have royal colleges and institutions that serve our health service, but not necessarily hospitals. And even GP practices will have lunches and meals together. So it's around normalising plant-based meals within healthcare settings, and using the approach used in New York City hospitals called plant-based by default, where you're not removing anything from the menus, and there's no restriction of choice, but you just prioritise and normalise the plant-based meal as the first, second or third option, have many more plant-based options available, such that it's easier for for people to make that healthier, more sustainable choice. And as you say, you know, the results from the New York City hospitals has been quite remarkable, with more than 50% of patients sticking with a normalized default plant-based option. And there's quite a lot of support for that. So we are launching on October 16th on World Food Day. There'll be some comms coming out about that, and we've had around 20 organisations endorse the letter, over 1,000 healthcare professionals, still collecting signatures from healthcare professionals, and we'll be sending it to every healthcare institution and asking people to make contact with us, to get in touch with Greener by Default, who we are very much working with to make this a reality in the UK. And actually there's already a pilot going on at the Royal National Orthopaedic Hospital, where we're going to have our launch event on October the 16th. So yes, that's to come in a few weeks time. Oh, and I hope you can hear me, James.
Fantastic initiative. Best of luck with that.
Yeah. And I guess Tim was going to ask.
Yeah. No, go on.
I was going to say Tim was going to ask us about our panels at the conference, and I'm hosting a panel called Vegan Advocacy and Healthcare, and I'm hosting it with 4 other plant-based health professional members. We've got a dietitian, nursing, our nursing lead Giovanna. We've got might be Tim coming back. We've got a GP and we've got a hospital doctor, all talking about how they have initiated projects to implement diet change within their own healthcare setting. Hi, Tim.
Hi, Tim.
Hello, everyone. I've no idea
Welcome
what's
back.
happening. Have you just been carrying on talking?
We've carried on.
I don't know if people have been able to see this or what. Unfortunately, there's a technical problem there. The whole thing crashed. So I don't know what's been happening the last 5-10 minutes.
Oh, no.
So if we're still live, if you're watching us now, I will watch back and I'm sure we'll have a laugh. But unfortunately, there's some technical problems.
Oh.
I think we're back on now. I think everything's working. So I've no idea where I was talking to you both.
Well, we both explained our organisation. Are you there?
That's fine. So I don't know what to say. I don't know what's happening on my end at all. Shireen.
Yes, I'm here. I can.
Okay. Now we'll just see if this settles down. Otherwise, I'll have to end the stream.